In 2013, San Nicolas, Ilocos Norte, among other towns in the Philippines, were in a state of calamity after cases of chikungunya surged to more than 300. Last October, the Provincial Health Office of Cavite declared the province under a state of calamity after detecting 470 suspected cases of chikungunya.
According to the Department of Health, a total number of 100,401 suspect dengue cases were reported nationwide from January 1 to August 20, 2016, which is 16% higher compared to the same period last year. There are 422 recorded deaths compared to 228 deaths in 2015. As of 2016, the Philippines also has a total of 12 recorded cases of the Zika virus, including a pregnant woman in Cebu City.
The Philippine Constitution says that the state shall protect and promote the right to health of the people and instill health consciousness among them. I'm Dr. Lilian de las LLAGAS, Professor of Public Health, UP Manila, and a medical entomologist. Welcome to Kalusugan ay Karapatan.
Kalusugan ay Karapatan is a program that will inform the Filipino about how health as a right should be demandable and enforceable in addressing various health and wellness concerns in the country. I'm Dr. CARMENCITA Padilla, Professor of Pediatrics and Genetics at UP Manila. Our guest for the episode today is Dr. CLARITO, CAIRO, Program Manager of the National Dengue Prevention and Control, Emerging and Re-emerging Infectious Disease Prevention of the Department of Health. Dr. CAIRO, Dr. Lily, would you like us to tell us the differences about the three diseases?
Okay. So we can distinguish the three diseases based on the signs and symptoms. For Zika, the prominent manifestation is rash, usually a maculopapular rash. And then for dengue, the prominent manifestation is high fever. And then for chikungunya, the prominent manifestation is joint pain.
Dr. Lily, is there anything else you'd like to add?
What is very important for us to see and understand at this point is trying to understand who are the population at risk. For dengue, the children are the most susceptible and therefore the most population at risk of the different segments of the human population. For chikungunya, the most population at risk would be the elders experiencing the joint pains. And for Zika, the newly declared endemic disease in the Philippines, the population at risk indirectly, in particular, effect on the child or fetus or the neonate is the mother who is pregnant. Both are locally transmitting and the three are public health problems in the Philippines.
But when you talk about age, that's practically everybody in the Philippines. You're talking about children in schools, you're talking about mothers, you're talking about old people. So can we say that it is endemic in the country, Dr. CAIRO?
Yes, it is highly endemic in the country. We have documents to show that as early as 1950s, dengue and Zika were already here in the Philippines.
But why is it that we have so many programs on dengue, but Zika is something emerging as a topic right now in the country? Is there any reason for this?
Because lately, last February 2016, it was declared by the WHO as a public health emergency of international concern. And lately, the Department of Health, in coordination with the Research Institute for Tropical Medicine, strengthen or beef up their capacity to test for Zika.
We know of many cases of dengue, but do we have Zika cases in the country?
Yes, we have, as of last week, we have 19 cases of Zika, laboratory confirmed cases.
Can you tell us where these patients are?
From the 4 regions. So from Region 6, Iloilo, then Region 7, Cebu, and then Region 4A, Rizal and Batangas, and then NCR, Muntinlupa and Mandaluyong.
We talk about mosquitoes, Dr. Lily. So are we talking about the people traveling, or are we talking about mosquitoes flying to the different parts of the country?
Let's put it this way. It is locally transmitting and it is endemic because the mosquitoes are around and there are cases around having close contact with the mosquito. When a mosquito bites this case, the disease can be locally transmitted and is spread. It can really be acquired from other countries, and in the Philippines, if it is locally transmitted or endemic, meaning the two important elements are present, the infective mosquito and the human susceptible host. Yes, of course, it can be acquired from other countries known as endemic countries, and there is danger there if one goes to an endemic country, goes back to the Philippines, and when the mosquitoes are around, there would be a close contact between the human and the vector mosquito.
You talk about the humans now and the vectors, the mosquito. So, do we have a program right now in the country addressing both the vectors and the people?
Yes, that's why we have this National Dengue Prevention Control Program and the Emerging and Re-emerging Infectious Disease Program, where Zika is included.
Okay, so you say it's included. But in terms of addressing the vector, Dr. Lily, is there anything different with how we will address the dengue and the Zika cases, considering that we're talking about the same vector?
There is no Zika nor dengue or chikungunya if there is no mosquito. There is Zika, dengue, and chikungunya because the mosquitoes are aging, meaning aging mosquitoes are those that have fed on blood and have continued to be alive on a day-to-day basis to bring about transmission and spread. That is the reason why we believe that the dengue control program should not only be looking at removal of containers, but being able to attack the mosquitoes so that they will not age. For humans, we want the seniors to be protected. We want aging senior humans. But for mosquitoes, we don't want them to be alive more than a day. That's dangerous.
Yeah. Actually, we have this 4S strategy from the Department of Health. 4S stands for, first, search and destroy the mosquito breeding sites. And then the second S is self-protection measures, meaning the use of insect repellent or mosquito repellent, the insecticide-treated bed nets. And then the third S, seek early consultation. So if you have fever, and then rash, then joint pain. Then last S is say yes to fogging only during outbreaks.
Okay, so we read this in the papers. You know, we hear fogging as a measure conducted in public schools or private schools when there is a diagnosed case. Can you comment on fogging, on how important or how significant is this measure in terms of controlling the vector, Dr. Lili?
Yes, fogging is useful to a certain extent. It dramatically lowers the population of the biting female mosquitoes. Of course, when we fog, they're killed, and no mosquitoes can bite if they are dead. So fogging at a certain extent can dramatically reduce transmission of these three mosquito-borne diseases. And if it is going to be used indiscriminately, perhaps the program should define what is discriminate fogging. And fogging must be based on mosquito surveillance indices. Yeah. Perhaps the Department of Health can provide guidelines on what is really the meaning of indiscriminate fogging, and saying no to that is very important because the local government unit must be able to use that policy such that mosquito vector control is implemented appropriately before transmission, during transmission, and after transmission.
You're right, Dr. Lily, because indiscriminate fogging may lead to insecticide resistance.
Yes.
So we don't like that, we don't want that. We have guidelines for the fogging, like we have to do 4 cycles of fogging, 4 weeks apart.
4 weeks apart.
Yeah, and then within the 200 meter radius from the household outside, like that, and then we combine now fogging with indoor residual spray.
So let me just clarify this. We do not recommend weekly fogging. There is a policy on how it should be done.
It's part of
and
the
there
guidelines.
is guidance. There's guidance from the Department of Health.
4 cycles.
And all of the schools are aware of the guidelines.
That we don't know if they're compliant with the guidelines.
So that's one message. We want all the schools to be aware of the guidelines and the policy.
Barangay level, actually. Barangay, the barangay people will do the fogging for the schools.
I see. So the barangays are actually aware. Okay. But here, what we're saying now is that we'd like all the schools to know about the policy because indiscriminate fogging will cause resistance and it's not going to help the eradication of the vector.
Yeah. May I ask
Yes.
Dr. CAIRO? Would you agree that the 4S strategies are not really working? Because if these are working, there would be no outbreak of dengue. Am I correct?
Yes. Yes.
Please explain, please explain. This is very important because we have a national program and we are campaigning for the 4S. Maybe the question now is, what are the limitations of the 4S?
Yes, the limitations. Actually, the implementation. We haven't institutionalized the 4S in the community. We have before Action Barangay Contra Dengue, Abacada, and then the 4 o'clock habit. Some, or only a few of our barangays practice the Abacada and 4 o'clock habit. And some of them, or most of them, Ningas Kugon.
Okay.
So no sustainability.
Sustainability. So that is where the Philippines is different from Singapore. Mosquito breeding is a crime in Singapore. You can be penalized paying approximately more than 1,000 Singapore dollars because you're breeding dengue mosquito in your backyard. Will that work in the Philippines? Can we legislate that?
Personally, I'm in favor of that. Additional, some of our people, they don't see the value of source reduction with regards to mosquitoes or search and destroy the mosquito breeding sites. Whereas it's the ultimate solution to the problem with the mosquito-borne diseases. So if we can legalize or we can have a law to penalize those households who don't practice the source reduction method or search and destroy.
You think it's realistic under Philippine cultural conditions? That
it's a wish list, maybe.
A wish list, so.
Question, about that statement to have a law, because I'm a strong believer that we can actually have the policies out of the Department of Health and instead of pushing for legislation. The reason is it takes so long to get a law passed in the country. So my question now is, what will be effective? What will be effective for the Philippines wherein we can have this implemented, let's say, within the next couple of months? What will be a viable solution to that problem instead of legislation?
Since we have the policies, we have the guidelines, we just have to implement them.
Okay. So I want to go to the issue of implementation. So for implementation, I totally agree with you that the Philippines has so many laws and the challenge actually is in the implementation. So can you tell us now who are the key stakeholders who can push for the implementation of this policy that you have put out from the Department of Health?
Our local government units.
I think they're listening, so we'll reach out to them, the local government
down
units.
to the barangay captains.
Down to the branch. So we have the DILG will be a key player in this case.
Then the DepEd is also part of the stakeholders. So with regards to school-based interventions.
Okay. So am I correct in saying that since the Department of Health is the main main agency, the lead agency for this project, a big push from the Department of Health, together with DILG and DepEd, and probably other stakeholders, can actually push for better implementation?
Actually, Dr. Menchit, we have in mind to include in the criteria for the seal of good local governance of the DILG, the practice or the conduct of 4S or source reduction or the search and destroy.
Okay, I'm confident that you'll work on that. But I have another question for Dr. Lily. This
I
time...
have another question.
Oh, okay, yes.
Let me ask this question because this has been inside my heart for many years. Do you think dengue, Zika, and chikungunya are market-driven vector-borne diseases globally?
We can assume, just like in the pharmaceutical industry, right? And why not in the vector, in the insecticide industry?
Can you say something a bit so that we would be able to understand external and internal pressures attached to the problems on dengue vector prevention and control?
Yeah.
Side by side with chikungunya and Zika, let me give this statement. Dengue kills. Do you agree?
Yes.
Because mosquitoes are alive. Do you agree?
Yes, yes.
Is there a relationship between a market-driven pesticide application and because mosquitoes are alive, that's why dengue kills? Am I correct in this
Yes, absolutely.
pronouncement?
Yes.
So, realistically, are we part of the global scenario of this dengue and Zika and chikungunya?
Yeah. Perhaps it's market-driven.
It's market-driven? Dr. Menchit.
Well, I will actually reverse the question to you because I think that the market drive is just one piece of the puzzle. I mean, if I look at the three diseases, I look at them as more of a public health program. Yes. And I think you'll be the best person to tell. Not a simple disease. It's not just fever. It's not just pain. It's just not a rash, but it's a public health program. So I'd like to move on to that angle of saying that it is a public health program. Dr. Lily.
Okay. Dr. CAIRO. Well, these mosquito-borne diseases are public health problems. They're not really medical problems. It is a complex problem because the predisposition to the risk factors contributing to the disease endemicity is highly social, cultural, economical, and perhaps anthropological problems. And it becomes a medical problem if there is already a delay in the diagnosis and management of these diseases. Otherwise, these diseases are preventable. It's just that it is very important that we do have a proactive dengue control, Zika control, and chikungunya control in the Philippines. It's easier said than done. It becomes an alarm bell when there are outbreaks, but mind you, this can be mitigated. Perhaps we can look at other modalities of solving this problem. We really need to put interdisciplinary approaches here, a clinician, pediatrician, public health specialist, and most of all, we need some motivation for the community to be able to realize the risk of acquiring these diseases. And that's why I would always say that the nearest to the problems are the farthest from the solution. The communities breed mosquitoes, but they don't mind being bitten because they're still alive. That's why it is a problem. We need a certain level of behavioral change. It must be an an environment problem, as is in Singapore. Dengue in Singapore is not a medical problem. Dengue is an environment problem because, after all, even with climate change, everything is environment. Cleanliness of the surroundings, getting rid of containers, and a good water pipe system in schools and in the communities.
So that actually gives a lot of hope because it's preventable.
It's preventable.
And
yes.
it is possible to manage the problems. And we only look at the patients, but now we're concentrating on the vector, the mosquitoes, because that may be the part of the biggest solution. But now going to the patient, because we've spent a lot of time talking about the vector and the mosquito, I do want to ask, if I were a mother and I have a child with any of these symptoms and I don't have any money, where can I go? Dr. CAIRO.
You can always go to the hospital.
Which hospital? Will I be free?
Government hospital. All our indigent patients will be entertained. They will be enrolled to PhilHealth if they are not yet enrolled. So we have this no balance billing policy. So the hospital can enroll them and then they can be admitted if necessary.
But I know that there's a case rate for dengue.
Yes.
But there is no case rate for Zika.
Not yet. Yeah, it's a work in progress.
So if I have these symptoms, I can just go to any government hospital and I can be attended at the emergency room. And if
you can be assessed there. And then for the Zika, the confirmatory test is only at RITM.
Is it free?
Yes, for free.
Okay. So what we're saying now is that there is a test that's available and it's accessible because it's free at the Research Institute of Tropical Medicine, that's RITM, which is actually part of the Department of Health. Okay, so we talked about the testing, but if you read the newspapers right now, they talk about microcephaly, small head. Okay, so would you like to give a comment on the big surge about looking for all the patients with small heads, all the babies with small heads, possibly secondary to Zika?
Actually, Zika was declared a public health emergency of international concern because of the complications. And we call it congenital Zika virus syndrome, which includes microcephaly.
Okay. Can you tell us a little about the pregnant being exposed so that our viewers can understand why we're talking about the small head at this point?
Yeah, because studies have shown that the virus can actually affect the newborn, the fetus. So it can lead to complications like microcephaly, microphthalmia, or pagliit ng mata. So among them. But not all pregnant women who were affected by Zika can automatically lead to those complications. So not all pregnant women.
Do we know who among the pregnant women will eventually have a baby with a small head?
Yeah, predisposing.
Yes?
We cannot determine that.
Okay. So what's our message to our pregnant women?
Yeah. They have to do the regular prenatal checkup, especially the ultrasound. It will be done 2 to 3 times in the pregnancy. And then they should apply insect repellent or mosquito repellent. They are safe in pregnancy. Usually those containing DEET or diethyltoluamide, then the icaridine, those are safe for pregnancy.
So we're saying now that if a woman is pregnant, okay, they should not self-medicate but rather consult. Kailangan magpatingin na sa doktor just to find out if there is a problem that's deeper. No? It's not just an ordinary virus but could be a Zika case, yes. Right? And then the baby, the fetus, the baby, the unborn can also be monitored.
Yes, through ultrasound. Actually, during the prenatal checkup, it will be part of the history taking, the history mosquito bite.
Okay, but I have a question about the repellent because you mentioned about the repellent because you're saying that you are recommending that if there's a risk of Zika in the community, recommend the mothers to actually apply repellent. But can one of you comment on the use of repellents? Dr. Lily, would you like to comment on that?
Of course, we don't want Zika. Repellent, there are 2 types of repellents. One is skin and the other one is smoke. This smoke repellent is not cigarette, you know, it's more of katol. In areas when people are highly marginalized, economically marginalized, you can't tell them to buy repellents. It's so expensive. Yes. Moreover, it gives false hope as well because its efficiency is highly related with your level of sweating or perspiration. Example, you buy a repellent, at least 150 pesos, with good odor because perfume, it will protect you from being bitten for 6 hours if you are not sweating. But if you sweat profusely like children and other people who are actively engaged in anything, because of the carbon dioxide emitted, the sweat, carbon dioxide, your breath, mosquitoes are attracted to you. You might have applied repellent on the lower your knees, but you don't apply repellent on your faces, mosquitoes will still bite you on your faces. So is it effective or not? If I'm a tourist, I go to the Philippines, my safest protection measure is the repellent. Will it solve the problem? It will prevent the mosquito from biting, but it will never say, and I cannot say, it will protect you from acquiring the disease. Mosquitoes can still bite you any part of your legs. At a certain extent, Dr. Menchit, it is effective, but there are restrictions to the use of repellent. You can't use it more than 3 times a day for 24 hours. It has some risk because it is DIT-laden.
So the message is we still want to control the vector because that's the symptom, not touching the person. Okay. You know, we talked a lot about dengue and Zika, but then we mentioned very little about chikungunya and, you know, about the joint pains. Would you like to comment, Dr. CAIRO, how are we addressing this? I know there was an outbreak a few years ago, but we have so many old people with joint pains and sometimes with fever. Will this be a recommendation that when you have fever and joint pains that you should have your test for chikungunya?
Yes.
Is that a recommendation at this point?
Yeah.
Okay.
Only a few of our elderly people can have a debilitating joint pain due to chikungunya. That is why, and it's really fatal. Chikungunya is really fatal. So more supportive management, that's what we're doing for the patients with chikungunya. So that's it.
Okay. So may I say something about chikungunya?
Yes, please.
These mosquito-borne diseases are dictated upon by the presence of the mosquito. I go back to the mosquito because that's the culprit here. Chikungunya, if you study the local epidemiology of chikungunya, we have done analysis of the data we have. It's common among elderly people. And if you will try to correlate between the endemicity of chikungunya and the mosquito, the vector responsible for chikungunya is Aedes albopictus. And Aedes albopictus breeds in natural containers, plant axils. And when there are more vegetations and plants, there would be more mosquitoes that are going to be biting humans, particularly the older people. It is also a very debilitating disease because my aunt contracted chikungunya. She's the national scientist, Claire Baltasar, who contracted chikungunya, and her doctor then was Dr. Campos, Lourdes Campos. And serological studies showed she contracted chikungunya when she was attending to her plants because she's an agriculturist, and she was bitten by mosquito Aedes albopictus in her garden. That's the exposure to chikungunya, and I think these diseases can really be prevented if we do have proper translation of information from up to bottom.
Well, that's good because, as I said, again, there's hope because it's preventable. But because the magnitude of the problem, we know that there is now a vaccine for dengue. Can you just give us a comment on just a background, or where are we right now?
Yeah, the dengue vaccination will continue. Our second dose will be scheduled, is ongoing right now, October to December. Second dose for regions 3, 4A, and NCR. And then it will be expanded to Region 7, Cebu, by January next year.
So what we're saying is that the dengue vaccine is here to stay, and you should ask your doctor about it. Is that the correct way of saying it? Just ask your doctor about the dengue vaccine, and that can be explained to them. We don't have vaccine for Zika and Chikungunya, right? None. Okay. So how is media helping us in this campaign? What is the role of media in pushing for the campaign of the Department of Health?
Okay, our media is helping us disseminate the 4S strategy. And then, especially for the search and destroy, the source reduction method, we need to control the mosquitoes. So we need to do the vector control, as they say.
Okay, so what we're saying now is that media is definitely going to be part of.
Has a vital role. They have a vital role.
Is there a role for research and development in these diseases?
Definitely. All the gaps,
aspects?
all the missing links. For example, Zika.
Forecasting.
And forecasting of the vector surveillance aspect.
Okay, forecasting, surveillance, and the
Sa
development
for Zika.
and the development of the diagnostic kit. So I go back to the statement of Dr. Lily saying that it's a public health program, and we need all stakeholders to be engaged so that we can actually better understand these 3 diseases and to better control the problem, since it is a preventable condition. These 3 are actually preventable. Okay, so I just want to ask for a message, a single message to our viewers. Do you have any message? One message? If there's one message, yes?
I reiterate our campaign in the Department of Health, 4S, don't forget. So, search and destroy the mosquito-breeding sites, seek early consultation, self-protection measures, and then say yes to fogging only during outbreaks.
Okay, what about Dr. Lily? What is your single message to our audience?
The effectivity of the media here is the key factor, because the media would have the greatest, the deepest, and the largest way to communicate to the public. The media should be able to tell the people that mosquitoes breeding is not really in the canals, but in the containers. Search and destroy of containers might be difficult, but at least it is the least expensive, but the most difficult to do religiously. That's why search and destroy is not really working very well, because people do not have the time to search for mosquitoes and destroy the mosquitoes. I hope the media would be able to come up with a communication that will tell people dengue kills because mosquitoes are alive.
Okay. So Dr. CAIRO, Dr. Lily, it's been very informative. The past 45 minutes, they have given us new information about these 3 diseases, and I know that there'll be more questions that will be asked from both of you, and I do thank both of you for this opportunity to learn more about these 3 diseases. Thank you very much.
Thank you very much.
Thank you. Dr. Menchit, Dr. CAIRO.
Thank you very much.
And good morning to all.
If you have any questions about these topics, you may post them at our Facebook page, and join us again in our next time in our episode of Kalusugan ay Karapatan. When you have fever or a rash or joint swelling, you must consult. Not all of them will be dengue, Zika, or chikungunya.
These diseases are locally transmitting Because mosquitoes are alive, prevention is always better than cure. Clear your surroundings. Don't make the mosquitoes survive. Kill them.